Hi guys! We are going to show you all 206 bones of the body and some key parts that you should memorize for this class.
So now we're going to talk about the different regions of the cranium and the facial bones. So we're first just going to orient ourselves to the bigger regions, and then we'll go through the characteristics later. So the first thing, we're going to talk about the frontal bone. So the frontal bone is highlighted here in yellow. It's very easy to see. And then the parietal bone is going to be green. So the parietal bone's here, and you can see kind of through how it goes. The occipital bone is blue. It's in the back. And then the temporal bone is better seen on this one. So outlined in purple here is the temporal bone. And then the sphenoid is going to be this peach color here. And you can see it has a process, this goes all the way around. And then the ethmoid bone, which you can't see in this one, but you can see very well in this one. It's labeled in red here. So I'm gonna flip this up. You can see it kind of through here as well. And then at the top, there's also a process. So the ethmoid bone is just kind of hidden there, but it's there. And then we'll go over the sutures. So the corneal suture is going to be this one right here. You can see it well. So this is cutting the head dorsal and ventral sides. And then you have a sagittal suture. So the sagittal suture is going to be cutting it kind of in half. So you're going to be cutting it in left and right side of the body. And then you're going to have the squamosal suture is going to be on the side here. And then on the back is going to be the lumboidal suture.
Okay, so some of the facial bones are the lacrimal bones, which are right here. And you can remember that because lacrimal is stands for tears. So these are right where like the tear ducts of your eyes would be. The nasal bone is right on top of your nose, and you can generally feel that bone whenever you touch the bridge of your nose. That's the nasal bone. The inferior nasal conchae, it's really good to look on this one. So there's two conchae inside the nose, and the bottom one, these on either side, those are the inferior nasal conchae. The zygomatic bone is this bone right here. Also have the vomer, which is this bone right down the middle of the nose. So the maxillary is this bone right here. The mandible is down here where your chin is. The palatine is like on the roof of your mouth. So in here, it's in orange. This is the palatine bone. And this right here is the hyoid bone. It's not technically facial bone because it's down where your neck is.
So now we're going to talk about different specific features of the cranium. So we're talking about the frontal bone. So the frontal bone is seen in yellow here. So there's a frontal sinus inside of this bone, and it's very hard to see with the different skeletons that we do have. So we thought a picture would be best. So the frontal sinus is going to be located right here, and this is a part of the frontal bone. You can see that this is the frontal bone, and then we are looking at a sagittal view of this. So now we're talking about the parietal area, which is in green. So one of our characteristics that we have to know for the parietal area is the parietal eminence, and that is found in this region right here. So it's kind of a region that's marked off, and it's going to connect the parietal fascia. So the next thing we're going to talk about is the occipital region. So characteristics that we're going to have to know in the occipital region are the foramen magnum, and this is this hole here. So this is where the brainstem will come into the brain. And then the occipital condyles, which are going to be right here on either side of the foramen. So next we're going to look at the temporal bone, and we're going to look at it from the anterior section of it. So it's going to be in purple here. So the first characteristic that we're going to point out is the mastoid process. So the mastoid process is this bump here. And then the styloid process is kind of this jagged line that comes up on both sides. And the zygomatic process is seen in purple here. And then the other thing that we need to know is the external auditory meatus. And then that is right here, bilaterally, it's both sides, kind of like this hole here. And then the last thing that we have to know for the temporal bone is the mandibular fossa, and it's this indent here on bilateral sides. So next we're going to talk about the sphenoid. So the sphenoid is found in pink here on both sides. And first we'll talk about the sella tergita. So this is this piece right here, this process. And then you have the greater and lesser wing. So it's slightly confusing because the lesser wing is on top, and then the greater wing is going to be found here. So lesser wing, greater wing, and then the pterygoid process is, if we flip it the other way, this is the pterygoid process here. And then the sinuses are a little bit hard to see, but the sinuses, the sphenoid sinus, is going to be right here, bilaterally. So now we're talking about the ethmoid bone. So the ethmoid bone, just as a reminder, is what's in red. So we can see it from a superior and inferior view, the red there. So the first thing we're going to talk about is the crista galla. So this is this point right here, crista galla, and the crista galla comes out of the cribriform plate. So this is the cribriform plate, as you can see. And then the perpendicular plate, we're actually going to take a frontal view of this. So the perpendicular plate, as you'll see, is in here. It's inside of your nose. And then the superior nasal conchae is going to be, it's labeled number 10 here. So you can see it's on bilateral sides. And then the middle nasal conchae is actually best seen in this right here. So this is the middle nasal. So just as a reminder, middle nasal and then superior is kind of on either side here. And then the sphenoid sinus is difficult to see on these here, but the sinus, it would be where you would feel pressure around your nose, because this is this area that we're talking about, but the sinuses come up here and they're relatively small. You can hardly see from this view that we have. So next we're going to talk about the zygomatic bone, which is here. These are like your cheekbones in yellow. So a characteristic that we have to know is the temporal process of the zygomatic bone. So I like this view because you can see this is the temporal process of the zygomatic bone. And then just to know and to recap, this is right here is the zygomatic process of the temporal bone. So we're going to have the temporal bone and the zygomatic bone, and then both of these are going to have their own processes. So next we're going to be talking about the maxillary bone and the characteristics of the maxillary bone. So we're going to be talking about this area in here. So the palatine process is something we're going to have to know. So we'll take an inferior approach to look at this. So this is going to be the palatine process. And next that we'll have to know through here is the maxillary sinus. And then sinuses are really hard to point out with these given structures in the camera angle. So I think it's best if you take a sagittal view and you can see where the maxillary sinus lays amongst the maxillary bone. So next we're going to be talking about the mandibular bone. So again, this is your chin. So the body of the mandibular bone is going to be here. So this in here counts as the body. And then the ramus is going to be here. And then the condyloid process, also known as TMJ, is going to be this outjut here, but it's not to be confused with the coronoid process. So a good way to remember this is coronoid is closer to maybe the core, and then the condyloid process is behind that.
So now we're going to talk about the differences between the cervical, the thoracic, and the lumbar vertebra. So here I want to point out in the cervical vertebra, all 7 have transverse foramina, which are these holes on the sides. And now I'm going to use the lumbar vertebra to talk about the other parts of the bone. So here we have the body, that is going to be this big mass. Then we have the spinous process, that's going to be sticking down like this. On the sides, we have the transverse processes. Then here, these two, which are superior, they are called the superior articular processes. And in here, they have the facets. And then below them, the inferior articular processes and the facets, which are on the posterior side of the bone. Okay, so now we're going to talk about 2 specific bones in the cervical region. So the first is the atlas. This is C1. This is C2, called the axis. So the way I tell the difference between these two is that the axis is going to have the odontoid process, which is sticking out, and the atlas is going to be more flat.
Next, we're going to talk about the primary and the secondary curves of the spine. So you can see the primary is going to be the thoracic and the sacral spinal curvature, and these are backwards C's almost. And then the secondary sounds like C, or is going to curve this way. So we have the cervical curvature looking like a C, and then the lumbar curvature looking like a C.
Okay, so these are all intervertebral discs. They connect each of the vertebrae between the body so they can line and form the spinal column. The parts of it are as shown. So this outside is annulus fibrosus, and then this middle center in here is called the nucleus pulposus.
Now we're going to talk about the thoracic cage, which you can see here. So this bone right here is called the sternum, and then this is the body of the sternum, kind of this entire thing. And then up here is the manubrium. And then we see the clavicle is attached here. So these are the clavicular articulations of the manubrium. So the manubrium, and then the clavicular articulations of the manubrium. And then down here we have the xiphoid process. So then we have ribs that are connected here. We're not going to have to be able to tell the difference between ribs 1 and versus 8 or per se. But it's notable to say that we do have ribs 1 through 7 are true ribs, so we'll count together. So rib 1, 2, 3, 4, 5, 6, and 7. And that gets tricky, but you can tell this last one kind of pairs off. So this one is also a true rib. And then ribs 8, so this was 7. So ribs 8, 9, and 10 are considered false ribs. And then 11 and 12 are considered floating ribs. Okay, so it's notable to mention, you can see here in a darker color, this is the costal cartilage. So the costal cartilage is what connects the rib to the sternum.
Okay, so now we're going to talk about the clavicle and the scapula. So here we have the clavicle. It's sort of shaped like an S, and here is the sternal extremity because it attaches to the sternum. And over here is the acromial extremity because it attaches to the acromion. And then on this other side here, we have the scapula. And I'm going to show you a regular scapula that's not attached. So here we have a scapula, and I'm going to show you the different parts. So here we have the spine of the scapula. Here above the spine we have the supraspinous fossa. Below the spine is the infraspinous fossa. Then this one here is going to be a left, so it would be like this. And this is going to be a medial border. This is going to be the lateral border. So here we have the acromion, and then if we flip it to this side, this is the coracoid process. And here, where it attaches to the humerus, is the glenoid cavity. Then if we're looking at the posterior side, here we have the medial angle. This is the lateral angle. This is the superior angle, and this is the inferior angle. And directly below the infraspinous fossa, this portion would be called the subscapular fossa.
Okay, so here we have humerus bone. This is the head of the humerus. And then this is the anatomical neck. And this is the surgical neck, right there, these two grooves. This is the greater tubercle. And this is the lesser tubercle. In between those two tubercles, there's the intertubercular groove. And then if you go right down from that intertubercular groove, this is the deltoid tuberosity. That's where the deltoid muscle connects to the humerus bone. And then this whole part right here, this is the shaft of the humerus. Okay, so down at the bottom part of the humerus, we have the medial epicondyle, the trochlea, capitulum, and then the lateral epicondyle. Right here is the coronoid fossa. This is the radial fossa. And then right here on the posterior side of the bone is the olecranon fossa.
So now we're going to look at individual parts of the ulna. So the first thing is the olecranon process. So this is your elbow bone. So this is going to be this area in here, the olecranon process. And then the semilunar notch, or the trochlea, is going to kind of be on this same side here, and it's going to be this divot here. So this is the semilunar notch. So the radial side is the other way. So this is the radial notch. And then the head of the ulna is actually at the other end. So the head of the ulna is here, and then the styloid process is here. So next we're going to be talking about the radius. So this is the head of the radius, and then the radial tuberosity is right here, and that touches the ulna, and then so that's also on the same side as the ulnar notch. And then the styloid process is going to be on the other side as the radial notch.
So on the hand, we have all of these bones right here, the carpals. Right here are the metacarpals. Right here are the phalanges, and then you have the proximal phalanges, the middle phalanges, and the distal phalanges.
Go ahead.
So reviewing some key joints that you should remember about our skeletal system, we have the sternoclavicular joint, and that's where the sternum attaches to the clavicle. Then there's the acromioclavicular joint, where the clavicle attaches to the acromion. And then we have the shoulder joint. This is where the humerus attaches to the scapula. Your elbow joint is where the humerus attaches to the ulna. For radioulnar joints, there are two of them. First, we have the proximal radioulnar joint, and then the distal radioulnar joint. In your wrist, we have a joint where the carpals connect to the radius and the ulna. And then the intercarpal joints are all of the joints that are connecting each individual carpal bone in your wrist.
Okay, so now we're going to talk about the ilium, ischium, and the pubis. We'll start with the ilium, So the ilium's going to be up here, and then the ischium is going to be here, and then the pubis is going to kind of be in the back here. So the iliac crest is the first thing. So this is this peak up here. And then you'll notice that we're looking at the anterior side right now. The anterior looks different than the posterior because you can see the acetabulum here. And so this is a really good way to orient yourself to where we are. So we're at the anterior portion of this. So for the spine, there are going to be different regions that we're going to talk about. The first one will be the anterior parts. So there's going to be anterior superior, which is going to be right here. And then there's going to be anterior inferior, which will be a little bit distal from that. So now if we flip it to the posterior side, we're going to have the posterior superior spine and then the posterior inferior spine. And then the other thing we're going to look at is the greater sciatic notch. And so the sciatic nerve is going to run right here. You can see this. So from the greater sciatic notch that you can see here, there's also a lesser sciatic notch. So the lesser sciatic notch is a part of the ischium, and you can see that here as well. The ischial spine is this little outlet here, and then on the posterior side, it's this big knob that you almost sit on when you sit down, and this is called the ischial tuberosity. Okay, so now we're going to move on to the pubis, and the pubis is this area down here. So the pubis will have the pubic arch, which you can see is this nice triangle looking shape here. So this will tell the difference between a male and a female. So males will be much more narrow and females will be much more wide. And then the pubis symphysis is here. So it's going to be a joint that connects both of these together. And then moving on to another joint, we're going to have the SI joint or the sacroiliac joint, which is going to connect to the sacrum in the iliac. So the name is a really good fit, and it's often abbreviated as the SI joint. And then in addition, there's also one more joint found here, and then this is going to be the hip joint. So the acetabulum and the femur are going to make the hip joint.
All right, so now we're going to talk about the articulated pelvis. The obturator foramen is here. The acetabellum is here. The pelvic brim is here. Here you have the greater or the false pelvis, and here you have the lesser or the true pelvis. All right, now we're going to talk about some differences between a female and a male pelvis. On a female, you can see that overall the pelvis is more light and thin compared to a male's, which is heavy and thick. A female also has a more shallow false pelvis or greater pelvis, whereas a male's is more deep. As far as the pelvic inlet, on a female it is larger and more oval, whereas on a male it is smaller and heart-shaped. Looking at the acetabellum, on a female it is small and faces anteriorly, and on a male it is large and faces laterally. Going to the obturator foramen, on a female it has a more oval shaped, whereas on a male it is round. And the pubic arch on the female has a degree that is greater than 90 degrees, and on a male the angle is less than 90 degrees.
Okay, so now we're going to take a look at the femur. So first we'll start off with the head. This is called the head of the femur. This is the neck. Then we have the greater trochanter, and this on the posterior side is the lesser trochanter. Here on the posterior side we also have the linea aspera, which is this line that kind of protrudes. Then we have the medial and lateral condyles. So this side is going to be medial. This will be the lateral condyle. Then when we flip this over, we have the medial epicondyle and the lateral epicondyle. Then on the anterior surface, this is called the trochlea surface or the patellar surface. And this is where the patella bone meets the femur and makes the knee joint.
Okay, so here we're looking at the tibia and the fibula. This is the anterior view of a right tibia and a right fibula. The fibula is on the lateral side in comparison to the tibia. And then the tibia would be on the medial side. So we have the medial and lateral condyles up here at the top of the tibia. And right here, this little notch in the middle is the tibial tuberosity. And then down here, this little notch that kind of pokes out of the end of the tibia, that's called the medial malleus. On the fibula, we have the head, which is right here. This is the head of the fibula. And then down here, we have the lateral malleus. And so up here at the head, this is the proximal tibiodistal joint right here. And then this is the distal tibiofibular joint down here at the bottom where they connect together. And this comes to form the ankle joint. So right here, the talus of the foot and the calcaneus come and form together with the tibia and the fibula. So then for the rest of the foot, we have, these are the tarsals right in here. These are the metatarsals. And then out here are the phalanges. There are three different parts of the phalanges. You have the proximal, middle, and distal phalanges.
We're going to talk about your clavicle. So it's a little bit tricky to tell left from right, but first I want to start off by showing you almost the S shape of clavicles. It kind of looks like an S from this angle, a backwards S from this angle. So I think what helps with identifying this is to find the fat meaty part of this, so you know that this is going to be attaching to the sternum. And then you should look for this point in the back of the clavicle, and this will be facing the anterior, or this will be facing the dorsal side of your body. So this will be facing towards your back. So this, in fact, is a right clavicle.
So to tell the difference between a right and a left scapula, we have the acromion and the coracoid process. So these are always going to be facing the lateral side of the scapula. So it would be this way. And we know that it can't go this way like this because the spine of the scapula is always going to be on the posterior side.
So next we're going to be talking about the right and left of the humerus. So this is fairly simple. So all you need to do is identify the olecranon fossa, and you need to orient this to the back. And then you need to make sure that your head is pointed medially. And then once you do this, you'll know if this is the right or the left, just by orienting yourself with the body.
Okay, next we're going to talk about the ulna. So to tell if it is a right or a left, you're going to locate the point, and you're going to know that this is going to always be facing medially. So we know that this is a right because this part is facing medially. Okay, so now we're going to talk about how to tell the difference between a left and right radius and ulna. So here you're going to have to, this is the ulna, you're going to have to find the radial notch, which is this point, and the radial notch is always lateral. So here we have a left ulna, and the radial notch is named that because this radius will fit right in here. And we know that this can't be on the right side of the body because the ulna will always be continuous with the pinky. So it has to be on this side so that it'll be continuous with your pinky.
So to tell the difference between a left and a right pelvis, first you're going to want to identify where the sacroiliac joint is, which is this rough part right here, and make sure that that's facing anteriorly.
So not this side. This side's smooth, and we want this to be facing towards the back, so the dorsal end of this.
And then also, at the same time, it should be medial to the rest of the pelvis because this is where the sacrum's going to connect together.
So it's not going to be on the outside. It's not going to be lateral. This doesn't make sense. It needs to be medial, and this needs to be facing the front.
And then these two parts in the front forms the pubic symphysis, and then the pubic arch, and so the sacrum would go right here. So this right here is the left pelvis, and this is the right pelvis. So for telling the difference between a left and a right femur, you want to look for the condyles, which are at the bottom of the femur. This right here is the medial condyle. This is the lateral condyle. So this notch in between them is going to be posterior. This is the anterior view of the femur. Once you know that, look for where the head is, because this is what attaches to the pelvis. So if they were like this, that wouldn't make sense, because the pelvis isn't connecting out here, it's connecting here.
But then this doesn't make sense because the patellar surface needs to be anterior.
Yes.
So it needs to be
So if you're thinking this is the front of your knee where the patella goes, and this is where it connects to the pelvis.
Next, we're going to be talking about how to tell the difference between the left and right tibia. So you want the condyles to obviously be posterior. So orient that first. That's the first thing you need to do. And then you need to look for the medial malleolus. And conveniently, the name says the malleolus needs to be medial. So just identify left versus right when you have it medial.
And then remember that the tibial tuberosity is right at the anterior side as well.
We're talking about the difference between the left and right fibula. This is slightly tricky. So the long, slender fibula lies lateral to the tibia. The lateral malleolus orients towards the posterior when the bone is properly positioned. It forms the lateral surface of the ankle. Note the orientation of the lateral malleolus. It points in a dorsal posterior direction.